Get started. Welcome everybody to Pre-Health Shadowing. Go ahead and drop in the chat where you are Zooming from. We are a program that is open to anybody who is interested, no matter where they are in the world. And so it's always exciting to see where they are Zooming from. Wow, I'm seeing people from everywhere. Welcome everybody. All right, just some housekeeping things before we begin. If you are not receiving emails and you would like to receive emails, we send, right now we're doing weekly emails with all of the sessions for the entire week. If you want to stay in the loop and never miss a session, I encourage you to follow these few steps. The first thing could be going to your email and finding pre-health shadowing. So you're gonna have to maybe look in your junk, maybe look in your spam. Once you find it, you're going to mark the email as important. By doing so, you're telling the email people that you want this email to go straight to your inbox. Another thing you can do is to save pre-health shadowing as a contact, and this will also ensure that it will go straight to your inbox. If you guys have any questions about this, or if you're unsure that if you're on the mailing list, you can go to our website, scroll all the way down on the home page to the footnote area, and you will see subscribe to the mailing list. Just a little update, we now have closed captioning for all of our live sessions to accommodate students with hearing disabilities. Another announcement is our website has been repeatedly shutting down due to the high load of students. We recently had a large influx of students joining us, and we are super excited that you guys are all able to join us on our journey. We just ask if you guys can help us raise money to keep our program alive. This is currently a free program. Our goal is to stay flexible and accessible for students. And so that accessibility part is we don't charge anything to be a part of our program. So we're just asking if you guys could donate $1, $5, $10, anything you're able to, be greatly appreciated. Yeah, I'll leave this up for a few seconds so you guys can scan it. You can also find this on our website in the menu tab under Donate. Thank you guys so much. Another announcement is if you are attending the live session today, I encourage you to post it on your social media. Pre-health shadowing is not a secret. We do want every student who's interested to know about this so that they have the opportunity to reach their goals. So please tag at pre-health shadowing and you might have a chance to get reposted onto our official account. Students can take a post-shadowing assessment to receive verified virtual shadowing hours. So take good notes. The assessment will be open at the end of the session and is open indefinitely until further notice. All right, and that is all I have for you today. I'm very honored to welcome to you our speaker for today, Dr. Jenna Hyer. Welcome.
Thank you. All right, I'll share my screen here. Let's see. All right, can everyone see my screen okay?
Yeah, looks good.
All right, well, good evening, everyone. Thank you so much for joining me. My name is Jenna Hyer. I am a periodontist, which is weird to say. I just finished my residency. And I really can remember very vividly going through the process of applications. It really, now that even though I'm 30 now, which seems old, it wasn't too long ago, I was in the same boat as all of you. So I hope this will be helpful. To be honest, I didn't even know what a periodontist was until I was in dental school. So if some of you don't know what that is, that's okay. And I hope I can kind of share my love for my career. So just a little outline, I'll talk a little bit about me and my journey into perio, through school. Also, we'll talk about what is periodontics. I have a number of surgery cases. That's really what the main part of my job is. And I'll talk about a day in the life, my current life, my residency life, we could talk about dental school, but we'd be here for a long time to talk about all three. So we'll focus on perio residency and just my current day-to-day. And then lastly, just a couple words of wisdom, whether you go into dentistry, periodontics, medical, anything. It's just, whatever I can share, I'm happy to. So a little bit about me. I was actually born in Saskatchewan, Canada. I saw someone on the chat was from Canada, so hello. I'm a dual citizen, but my family moved to Montana when I was 5, so I consider Whitefish, Montana, my hometown. I graduated from Montana State University with a degree in Cell Biology and Neuroscience. During my time in undergrad, honestly, my freshman year, I think I went through 3 different majors. I started as business, then nursing, then biology. Finally, I settled on biology because it really, satisfied any pre-health requirements for the most part, but I really didn't decide what I wanted to do until probably my, end of my 3rd year of college. So some of you are way ahead of me at the time. When I was in college, I did a little bit of research in a genetics lab, really just because I was interested in it and I enjoyed the teacher, but it didn't take me long to realize I was not cut out for laboratory research. So the summer between my junior and senior year, I went and shadowed a ton of different types of medical professions. I went to a veterinary clinic, I went to a medical clinic, hospital, and finally I kind of landed on a dental office. And I'll go into a bit more how I got into dentistry, but it wasn't until then that I really decided to go into dentistry. I also took a gap year, which was actually planned in advance. I had always been in school. I just really wanted to take a little time off and travel and just apply to school. I worked as a dental assistant and as a line cook at a restaurant, just a bunch of random things. Took some art classes. I just, took a year to do some things besides school. And I can't say, enough about how amazing this year was. And obviously we can't travel right now, but, I encourage everyone to just feel like it's okay to take a little time. You don't have to figure everything out from day one. Give yourself a little bit of break. But, I realized I couldn't be a line cook forever. I was making like $12 an hour or something. So during that time, I was applying and interviewing at dental schools. I think I applied to 7 schools probably, and I interviewed at 4, something like that. And I ended up going to Colorado. So I fell in love with Colorado. I really kind of based that on just not only the location, but also the school. There's many things that I had no idea until I was already in dental school. So if you ever have any questions, please feel free to message or DM me on Instagram. But I had the best time in dental school. It was so much fun. Also a ton of work. I kind of thought my life would just be over in dental school. So I went and traveled before that. But it turned out I was able to do some trips during our breaks. I was able to do some research in global health and went to Guatemala. As is the American Student Dental Association, I was the pre-dental chair. So I've always been passionate about mentoring pre-dental students. And even now that I'm out of residency, I've met a few now dentists who, I met when they were just still in college. So that makes me feel old, but also it's kind of cool to see them moving forward with their careers. Another thing I did, we had this kind of club called Perio After Dark, which was just like, it was actually at lunch, so it wasn't after dark, but it was just like a fun meeting. We'd have periodontists come share cases and kind of get everyone jazzed about perio. So, it's good to be pretty involved in school if you can, but also I just did most of these things because I thought it was fun, not just because I wanted to put it on my resume or something. So a little bit about, perio. When did I decide to specialize? So ironically, I went to dental school because, well, not just because, but part of the reason was that it was attractive that I didn't have to do a residency. I could just do 4 years of dental school and go on to be a practicing dentist. So ironically, I still ended up going to residency, but I went in just looking to be a general dentist. But along the way, just some of the people I met, some of the patients I had in dental school who needed dental implants or needed surgery just led me to meeting a lot of people in the periodontics clinic. So I decided during my 3rd year of dental school to apply to perio residencies. One of the, I'm not going to toot my own horn or anything, but the San Antonio residency is really known as one of the best perio residencies. A lot of that's just due to the faculty that are there. They're all, big names on the research circuit. So I was really encouraged to apply there, and I was kind of shocked that I actually got in. But that is, what I chose based on the program. I had never been to Texas before, so I went on to try something very new to me after living in the mountains most of my life. And I went on to get my Master's of Science and my Periodontics certificate, and I just graduated this last May, which was, we were just discussing, an interesting COVID graduation. So I'm very new into, the real world, I guess. So I always loved Colorado. I was hoping I could come back. So luckily, through a friend that I knew who was a periodontist in the area, I ended up finding a job in a group practice here. And I started working in July. And so I guess I'm on my 6th month, and it's been great. So I'm back in the same town, not too far from where I went to dental school, working in a private practice. So, before I talk about why I chose periodontics, I first need to say why I chose dentistry, because, one thing leads to the next. The first thing is, when I was shadowing a dentist, I really was struck by, her using dental instruments. Everything is very hands-on, very delicate, very artistic. And I have been making jewelry and painting and doing I'm just really into anything creative, really, for most of my life. So I kind of thought I'd actually be an orthodontist because I was pretty experienced at bending wires. But, this is kind of the main thing that combined my love of science and my love of art, which are kind of different things, but also have a lot of common, things in common. Another thing about dentistry is it gives you the ability to be a business owner, whereas a lot of medical professions, you are, working in a hospital or a bigger clinic setting. So it's kind of more rare now to see a private practice owned by a medical doctor, but it's pretty darn common with dentists. Another thing I liked about dentistry was the ability to really build relationships with your patients, see them and their families, kind of like for their entire lives, and also the work-life balance. So, we're generally working like 4 days a week. It's more of a clinic versus a hospital setting. I'm not a huge fan of the hospital setting. And generally it's non-life-threatening and more elective treatment, at least, what I'm doing. So I kind of like that the fact, my patients aren't going to die, at least not because of something I do. So there's a number of reasons, but that's really what initially drew me to dentistry. And then as I went on with my dental school experience, my number one love really became surgery, taking out teeth. I loved anatomy lab and dissecting and seeing all the muscles and everything in the mouth, the whole body. Periodontics really combines comprehensive health with oral health. So there are many things, many conditions that we see that is related to periodontal disease, such as diabetes, cardiovascular issues, Crohn's disease. It's really more, in terms of the dental world, it really takes into account the rest of the patient, not just their teeth. I also was really interested in anesthesia, which is kind of cool. A cool thing about my profession is that we can be basically like a mini anesthesiologist and also the surgeon. So, you don't really ever see that in any other type of field. And then also I found that I really like to focus on one topic rather than, in general dentistry, you do root canals, you do fillings, you do crowns, you do this and that. So rather than being, good or sort of good at everything, I'd rather be really good at one thing. And as you'll see, there's still a ton of different things that I get to do. So, just a little bit basic, what is periodontics? Again, I think everyone always breaks down the Latin roots and everything, but it really does make sense. So perio means around, dont is tooth. So there's several other dental specialties, endodontics, prosthodontics, orthodontics, and it's all kind of based on just different areas and different parts of the teeth or the mouth. So periodontics is really focusing on the support around the teeth. So the bone, the gingiva, there's a little periodontal ligament that connects the root to the bone, and everything kind of related to that. Okay, one second. So, like I said, even though I am a specialist, that by no means do I do the same procedure every single day. There's such a variety of things that we do. Kind of the main thing that we're known for is treating gum disease, which is periodontitis. We do dental implants, we do gum grafting, we do sinus bone grafts or sinus lifts, we extract teeth, we diagnose and biopsy oral lesions, and we also can do IV sedation. So periodontitis is inflammation of the tissue around the teeth, resulting in the loss of bone and the tissue attachment. And it's got many different etiologies, but it's really very known to be related to smoking, uncontrolled diabetes, family history, poor oral hygiene, poor dental care throughout their life. There's a lot of different factors. So, this is pretty basic kind of healthy versus not healthy mouth, but you can kind of see the difference where, the gum and the bone levels are pretty healthy versus on the bottom, there's bone loss, which is why the teeth look so long. There's lots of tartar and inflammation around the teeth. And that's, really the basis of our profession. So one of the types of surgery we do is just called periodontal surgery. There's many different little aspects of this, but I'll try to just kind of keep it generalized here. So when I say the goal of reducing pocket depths, the pocket means the space between the tooth and the gum, basically. So when we have bone loss, those pockets get very deep, very difficult to clean. Patients really cannot get down into that small little pocket. So our goal is to clean the tooth roots, kind of change the bone to have what we call positive architecture. We can do bone grafting if it's a very narrow, deep defect. And ultimately, our goal is to allow access for long-term cleansability, maintenance, and also just being able to hold on to those teeth for much longer. Another thing we do on a very regular basis is we place dental implants for missing teeth. So this is a case where, this man's missing 3 teeth, so we place 3 individual implants, which will, after they heal, can be connected to a crown or a tooth and, functions and looks and feels a lot like a natural tooth. In this case, this patient was missing teeth for several years, so we had to first off rebuild the bone. So that's what these screws are for. They're called tenting screws. We place those there with the bone graft and a membrane covering the bone graft. And our goal is to augment or grow bone horizontally or vertically for future implants. So the top is the first phase after it's healed. And then the second on the bottom is after some dental implants are placed. Another really, great treatment we can do for people who are missing all of their teeth, rather than wearing dentures that come in and out of their mouths, we can place, it can be anywhere between 4 and 6 implants, and actually place, this is called a hybrid prosthesis. So you can see it's kind of connects to those implants and gives someone a really beautiful smile and something that they don't have to remove, and has that kind of grandma factor of dentures sitting in a cup. So this isn't my, I would always rather save teeth when possible, but if someone's already missing teeth and they just hate their denture, it can be really life-changing to give them something like this where they can really function pretty normally again. All right, so again, very often I'm taking teeth out, and we can a lot of times put an implant in the same time. So this is called an immediate implant. So this lady had some infections around her teeth. You can look at that x-ray up there. The dark area at the tip of the root is all infection, and those teeth have had root canals, which is what that really bright white kind of cone-shaped thing is inside the root. So these are poor prognosis, there's bone loss. So we decided to remove the 4, place 2 implants, did some bone grafting. On the bottom left is kind of going back in to uncover the implants, put a little taller cap on there. And then the bottom right is her final bridge that she had to replace those 4 missing teeth. So another really, this is the procedure that kind of got me really jazzed about perio, but we can do something called a sinus lift. So after someone's been missing a tooth for a long time, their maxillary sinus tends to pneumatize or basically get bigger. It kind of drops down where those tooth roots used to kind of tent it up. So what we do here, actually this is a very similar procedure that ENTs will do. We make a little window into the side of the sinus, and we elevate the membrane and place bone graft below the membrane to allow us to put an implant there. So I actually have a cool video, hopefully it will play. So what we're watching here is the window, and you'll see every time this patient breathes, you can see his Schneiderian membrane actually moving up and down.
Oh wait, your slab's there. Your slab. There you go.
So it's not a surprise to me that maybe that's what overdid the them coronally, and that's what maybe.
Sorry, it's a little bit blurry. It's just living an iPhone video. So.
In your nose.
There he goes, breathing
out.
in and out. So that's always a fun video to be able to take. All right, so moving on to gingival grafts. There's many different types of grafts. The most common, probably the oldest one that we've been doing for maybe 50 years or so, is called a free soft tissue autograft. So up here on the top, you see the patient has recession on that tooth. That kind of yellow area is the tooth root. And there's a little bit of a muscle attachment that's kind of tugging on that tissue and kind of causing that recession. So we can take tissue from the palate or the roof of the mouth and transplant it down to this area, and it will heal and give much thicker, much more, sturdy tissue for a long term. Another approach, in certain cases, we can do a lateral pedicle flap. So we take tissue from the lateral aspect and kind of move it or pedicle it, transpose it over to the root surface. And again, trying to cover up that gum recession. So gum recession can, cause sensitivity. It can lead to cavities on the roots. So generally, we don't like to leave them, especially when they're this severe. All right, the next one is called a connective tissue graft. So I'm sure everyone here has taken anatomy class. We have epithelium, and then the next layer is the connective tissue. So we actually can harvest this piece of connective tissue from the roof of the mouth. So you take like a little sandwich from up there, and we can create a tunnel where we slide this graft into. So again, the goal here is to cover up the roots, to thicken the gum tissue, kind of prevent further recession and cover up any sensitivity. I have a video here as well. So this is showing the tunneling technique with this connective tissue, which is this little white guy here. And we kind of pull it through with a little purse string. There it goes.
Oh, good, look at this.
So that's just, I actually did 2 of those today. So it's a very common thing that we do.
I'm recording.
Oops. One of my favorite procedures, this is really just a cosmetic thing, but for people who have certain types of gummy smiles, we can actually remove some of the gum and bone tissue to make the teeth look longer. So here on the lower left, you can see the patient had pretty short square teeth, and actually she had some more enamel, which is the outer layer of the tooth, below the gum line. So we removed the tissue and then did some crown lengthening is what it's called. Put the tissue back and just, instant gratification. Patients are so happy because their teeth look so, their smiles look so beautiful and big. We also do crown lengthening for more functional purposes. So in this patient, she had worn down her teeth quite a bit and was planning to get some new crowns. So we needed to kind of lengthen those teeth again in order for her dentist to put some longer teeth on there. Another thing that we are always looking out for every time we do a head and neck exam is any kind of lesion that looks suspicious. Generally, they're red and white, kind of irregular borders, thickening. And a lot of times we are actually the first to identify conditions. Leukemia, Crohn's disease has a certain kind of manifestation in the mouth. Certain different cancers will metastasize to the mouth, and we can find those via other lesions. Also, uncontrolled diabetes is a big one that's related to periodontal disease. So this is, I wouldn't say a fun part. It's never fun to tell someone if they have cancer, but it is a really important part because oral cancer is extremely, extremely deadly, and it's generally diagnosed very late in the game. Okay, so another thing that we do is moderate IV sedation. So the difference here is, say you're in the OR and there's a patient completely has intubation, that's general anesthesia. That's not what we do. We do something just moderate sedation. So the patient is still breathing on their own, but they're kind of in a twilight zone. So we're trained to start IVs and really push these drugs and know how to manage any emergencies that can come along with the drugs. This on the right is in my residency. We had to learn on someone, so we had to learn on each other. So that was a fun day. So how to become a periodontist? You have 4 years of undergraduate, 4 years of dental school, and then 3 years of residency is generally the length of every perio residency. Okay. So now let's just talk a little bit about what is perio residency like. So they're generally around, I think, 32 to 35 months, so a little bit less than 3 years. There's many different components. There's a didactic component, there's clinical component, there's research, there's exams, there's rotations. So it really is a lot to juggle. And I'll go through each one. On the right side, on the top, that is in my residency, I was able to have my own little chair and operatory, which is really nice. And on the bottom is my entire class. So we have about 4 to 5 people per year. So, and some of the Air Force people join us for our first year. So didactic is a really big part, especially our first year. You kind of feel like you're back in the second year of dental school. And we take several classes throughout the entire residency. We take oral pathology, we take biomedical statistics, research methodologies, practice management, learning the business side of things. And every week we have a literature review. Well, for 38 weeks, we review about 20 to 35 published articles on different topics, which is surprising there's that many, but there are. So these are some pictures on the top. We have case presentations. It looks like a very empty classroom, but we all just sit in the very back and our faculty are up at the front. And the bottom and to the right are just kind of the reality of what studying looks like for these really big exams. It's, you know, I thought college was a lot, and then I thought dental school was a lot, and then I realized, you know, the more you go, just the more kind of information you are responsible for. So there is a lot of studying and a lot of reading. Okay, so the clinical part is really the part, you know, that we all are living for. In my residency, we did anywhere from 2 to 3.5 days a week. Starting out our first year, we're in the clinic a little bit less, but as each year went on, we were in there more and more. We were responsible for calling and scheduling our patients, doing the exams, writing up the treatment plans, having them sign all the consent forms, and then doing the surgery and the sedation. We had to clean up, set up for every patient. You know, we're basically like a mini dental practice in one person. So it is a lot to do, but it does teach you a lot about kind of how to run a clinic. All right, so research. As I mentioned before, I knew I wasn't cut out to be, you know, in laboratory research, but that is a big part of at least my residency. Not every residency requires you to do a master's thesis, but in order to get the Master's of Science or the MS, you do need to do a research project and defend your thesis. So this was a really big project for me. I'm actually, you know, approved for publication in the Journal of Periodontics, and it should be coming out sometime this year. I really don't know the date. They won't really let me know. So it's definitely a process, and basically designing and doing all your own data collection, writing up your thesis, and then ultimately I had to write up a journal article. So that was a big learning experience, and probably not something I'll be doing a whole lot more in my life, but it was another aspect of just what to juggle in residency. So I just want to talk a little bit about, you know, work and life balance, because, you know, it's so important to do things you love and spend time with friends and family, not just kill yourself studying all the time. So things I love to do is painting, traveling when you can travel, exercising. I don't know if there's any other Orange Theory people out there, but we almost had my whole residency into it at one point. And I love just doing anything outdoors. So it really is important to take time off, really just kind of regroup and get your mind where it needs to be. So I always take Friday nights and usually Saturday nights off at least from studying. So now, you know, it's kind of weird to see that I'm at the end of this journey, but at the same time, I'm kind of just honestly in the beginning, because I just started my career. But my, at least education is almost complete. I still have to take my board exam this next year. So a couple things you can do when you finish perio residency. You can go into academics, doing teaching or research at a dental school or a residency program. You can enter the military, or you can go into private practice. So there's different options here. You can start your own practice. You can join an existing group practice, or you can go into a corporate, which is, you know, becoming more and more common in dentistry, which is kind of unfortunate, I think, but that is another option. So a normal day for me now. So I'm working 3 to 4 days a week. I'm basically responsible for kind of building up my own practice. It's a lot of networking. It's a lot of schmoozing with dentists, which during a pandemic is really tough. Luckily, I have a good number of friends from dental school that are still in the area, but that is a really big part of being a specialist. And I'm not sure if it's the same for medical as it is for dental, but you kind of have to go around and do a lot of meet and greets to get, because we really rely on dentists referring us patients rather than patients just walking up to our door off the street. So a normal day, I'm generally doing new patient exams, I'm doing surgery, I'm seeing post-op visits after surgery. There's not a whole lot of other things really, honestly. We generally see a patient, meet them next time we do surgery, and then we see them as they heal. So the exception being people with periodontitis who we see for cleanings pretty regularly because they really need more often dental cleanings. We also, like I said, are visiting a lot of referring doctors, and we're involved with study clubs. So we create, or we're part of kind of continuing education. It's a great way to get together with dentists and other specialists and talk about patients or topics in dentistry. So that's something I've also been doing since I have finished school. All right, so just a couple words of advice, I guess. So if you were an undergrad, if you're thinking of pre-health, like I said, I mean, I did a biology degree just because it really kind of hit all those requirements. I'm sure many of you are aware of that. Research, I don't know how important that really is or if that played a big role in helping my application. Again, I would just say do it if you're interested in doing it, but it does help. And the most important thing is doing what you're doing now by watching these types of things and really try to go shadow people because, no matter what you think you may be interested in, until you're seeing it in real life and seeing someone living that life, I don't think it's easy to picture what that reality is. So this was really the most defining moment for me, was spending a couple days in dental versus medical clinics and just seeing really like what gets your heart racing and what gets you excited. For me, it was watching wisdom teeth being extracted, and I just knew at that moment that it was for me. If you're in dental school, so it's always good to keep your grades up. I think the most important thing that helped me was really getting to know the residents and the faculty if your school has a periodontics clinic. It's good to participate in extracurriculars, just kind of be well-rounded, and also talk to and shadow periodontists in your area. So again, it sounds fun and dandy until you really see the day that they're living. So some more tidbits for me to share. So, I think really what led me from one thing to the next is all just people I met, people who taught me about what is dentistry, what is periodontics, what is this or that. But I think that really speaks way louder than just doing a lot of research on the internet. So another thing is, this goes for medical or dental. If you're in it for the money, it's really not the job for you. There's many other ways to make money way faster than this. But you have to really be passionate about working with people, helping people, hands-on work, things that really motivate you. So, I always look at people who invent an app and just are millionaires and a little bitter about it. But, I know that I didn't go into this career just because of the money I would make. So some things I wish I would have known, especially in the dental world and medical, dealing with patients, this is what brings us to this profession, but it also can be just the thing that ruins your day. Some people just have terrible attitudes and other people have amazing attitudes. So, you just have to kind of have tough skin and not let it get you down. But also some of them are just, you meet really life-changing people through your patients. Also, dentistry involves a lot of business. So you can work as an associate versus owning a practice. but it really is such a big part. And, most of us are not well trained in business. So that is just another aspect to think about. Dentistry is very hard on your body. We're always leaning, we're always, we're not great about, well, not all of us are great about sitting up perfectly straight. So it's just something to think about that. And that's part of the reason we work, 4 days a week or whatever we work, because it's just physically really demanding. And specializing is a lot of kissing up to general dentists. So just something to think about. So that's really all I have. I would love for everyone to just feel free to just message me on Instagram. I post a lot of my surgeries on there, and I just love having conversations. I'm working on a blog as well, so that's not quite there yet. But yeah, please, please, please feel free to reach out. I love mentoring and helping people get, their applications or personal statements or whatever. So yeah, now I'd love to hear some questions from you.
Thank you so much for your presentation. It was amazing. There was lots of helpful information in there for sure. And now we'll get into some of the student questions. So our first one is, what is the most interesting treatment that you've had the opportunity to do?
Ooh, that's a hard question, but I think I love like challenging cases that involve, many different aspects of dentistry. So talking to the prosthodontist who's going to be putting the teeth in and, kind of putting our heads together for creative ideas. I love doing kind of like the full arch implants, dentures. I love doing sinus lifts. There's really not like one thing because I honestly like it all. One thing I will say is the most like standout thing that I experienced was we take a 3D x-ray or a cone beam x-ray for our implants. And one of our patients, we found this like massive lesion in her kind of like sella turcica area. I had to refer her to a neuroradiologist. And it was, that was scary for sure, thinking I had found some massive brain lesion. Luckily, it turned out to be like a meningocele, but it's still something that if it ruptures, could be very dangerous to her. So, that's kind of a really important thing I've learned is that, we can diagnose things serendipitously that no one else would have otherwise ever seen.
Thank you. The next question is, do you feel working as a dental assistant helped you as someone going into dentistry?
Definitely. I think it's good just to, learn simple things like the teeth numbers or the surfaces of the teeth, which we have many different terms for. In our first year, first class, we're all feverishly writing down this new language, basically. And it also got me comfortable just to like go into someone's mouth. So even if you're just holding a suction in there, at least you have got, you're used to how to sit and kind of instruments and how it works. So 100% highly recommend doing that if you can. It's kind of different in different states. When I was in Montana, I didn't have to take any classes or course to do it, but I would check whatever state you're in.
Our next question is, can you talk more about your trip to Guatemala?
Yeah, for sure. We have an amazing professor at our dental school in Colorado. Her name's Elizabeth Schick, and she started this program it's near Cotepeque, Guatemala, but really it's this like obscure little town. I don't even think, there's not really a town. It's actually on a banana plantation. So there's a school that's been built there for all the children of the plantation workers. And she helped kind of fundraise, get this program together to build a dental clinic right next to the school. So it's primarily children, but sometimes you end up seeing their mom, their uncle, whoever else. And we teach them oral hygiene. And the best part about it is that they go back like 3 times a year. So rather than going to, Dominican Republic or one of those trips where you just go and extract a ton of teeth and then you never go back, this program is really trying to instigate recurrent dental care for these people, which is amazing.
Definitely. Thank you. The next question is, did you enjoy your dental assistant job, and what exactly did you do?
So I was only working maybe 1 or 2 days a week as a dental assistant because I was also working at a restaurant and just traveling, and I don't even know now, it's been so long, but um, yeah, I mean, it was really helpful to me to kind of be on the other side and see what it's like to be part of a dental team when you're not the doctor. I learned that, there's sometimes the dental hygienists are mean to you, but I think just now as a doctor, I really can understand what it's like. You're running around, you're cleaning, you're setting up, you're sitting there suctioning when the doctor's working. Um, so overall, it was a very, very great experience. And the more you know, like the better you do. So some of the people in my dental school had been assistants or hygienists, and I mean, they had a major leg up over all the people who had never done anything dental wise.
Thank you. We have another dental assistant question. And this student asked, how did you become a dental assistant? And was there any license or training needed beforehand?
Yeah, so in my state, when I was in Montana at the time, you could just be trained on the job, but that's not true for every state. So I'd say the longest it would be, I think, is like a several week to a 9 month long program to be a dental assistant. I'm sure there's other ways to do it, but it's really state to state. So I kind of lucked out on that one.
Thank you. The next question is, what extracurriculars would you recommend for students interested in pursuing this field?
Are we talking like in college?
Yes.
So, I mean, I don't think I did anything in college that really prepared me for periodontics. And it's hard for me to say what was it on my application that stood out. I have no idea, but I did talk to a lot of people on the admissions committee. And honestly, first they look at your grades, your test score, your, letters of recommendation. But then when you interview, the main thing they want to know is just like, are you able to converse with people? Are you going to make it as a dentist? Because you have to be pretty good at talking to people. That's what we do all day long. So ultimately that's what thins you out, is just being a well-rounded person, just having a random interest like woodworking or piano, or it doesn't have to be anything dental related. I think it's good to have just any type of passion. It's always helpful if it's something to do with your hands. But in terms of extracurriculars, I honestly was not terribly involved in college. I wasn't in a bunch of clubs or this or that. So I think ultimately it's your grades, your numbers, but then also, are you just a well-rounded person outside of school?
Thank you. Our next question is, was it uncomfortable seeing gum inflammation and other conditions when you first saw them?
I'm trying to think of when, now I'm so used to it, it's hard to think of but no, I never was grossed out by anything in the mouth, and I still don't think, it doesn't faze me. It's definitely good to see some of that before you go into like the dental world or the surgery world and the medical world. That's why shadowing is so important. But I guess once in a while I see like a pretty bad case. I didn't show any on my presentation, but overall, I think it's really satisfying to clean teeth. So I think it doesn't bother me.
Thank you. The next question is, do you see differences in the type of care in areas that are more urban versus areas that are more rural?
Yeah, and a lot of that is just access to care. So unfortunately for me as a specialist, like we just tend to be congregated in more city settings. And that's mostly because we really need a certain number of population or a certain number of dentists who can support a specialist. So I think the number is maybe 30,000 people in an area to support a specialist, which for a lot of areas is just that's not the case. So, people have to travel much further. Even in Colorado, you go to the mountains and people are 2-3 hours away from another periodontist. So, and another thing, it really it's not an inexpensive profession. The treatment that I do is not something that every level of income can afford, unfortunately. So I do think the people with money definitely have a step up. versus those who don't. And the ways that we help that is by trying to volunteer at, we have a statewide, free dental weekend clinic. But yeah, it's a sad truth, but I just probably wouldn't be able to make it as a periodontist in a really small town. It's just a patient issue.
Thank you. Our next question is, how was the adjustment to dental school after your gap year?
Yeah, that was a wake-up call for sure. I think no matter what you're coming from, even if you come from college into dental school is like on steroids. You're taking, I don't know what the credit equivalent is, but it's, we had 5 or 6 exams a week at one point. I think we took 65 quizzes or exams in 1 year, which is way more than you do in college. So it's just, they tell you on the first week, it's like drinking out of a fire hose. It's just like so much information, and it's hard to kind of whittle down what you need to know. And as time goes on, you kind of figure out what your system is. For me, it was kind of turning a PowerPoint into like a written study guide. I had a little group and we kind of share them with each other, and that would just kind of help us condense information. So definitely was like a big change from not being in school at all. But even if I had come, I think, from college, you think, like I said, if you think college is a lot, then you go to dental school and that's a lot, and then you go to residency. You just, your threshold keeps raising for what you're able to do, but it's also good because it keeps pushing you to see what you can do.
Definitely. Thank you. The next question is from a current nursing student. They're wondering how far you got into nursing until you realized it wasn't for you.
So I didn't tell the whole story of my undergrad career because it's kind of complicated. I left Montana, I went to school in California. Then the whole 2008 crisis happened. My college fund was kind of on the decline. So I went back to Montana. So I went from, I think I bought biology major there, and then I was changed to business for like 1 quarter. And then I applied back to Montana as a nursing student. But I think within that semester I changed. So I don't know what it was really that changed my mind. I think I just wanted to do something a bit more generalized. So at the school in Bozeman where I went to, nursing was its own degree versus like biology was a separate degree. So I just kind of wanted to leave my options open and do a degree that I could kind of go into any health profession. I thought about PA school, I thought about med school, I thought about, all of them.
Our next question is, are the surgeries that you perform considered more medical or cosmetic?
So, I guess I would say for most of them, they're more elective, quote unquote, elective procedures. A dental implant, there are other ways to replace a tooth than a dental implant. You can get a denture, a partial denture, a bridge. A lot of times the people who are coming to us just aren't happy with those options. So, that's more of something, it's not medically necessary always to have a single tooth replaced. In terms of implants to hold on to dentures, so in Canada, as far as I know, it's just the medical gold standard to have 2 implants for the bottom denture and just a regular denture on the top, because the denture on the top has that suction onto the palate. Generally, people can do well with those, but the bottom denture is just, your tongue, everything is moving, it just can't suction down. So I would say those are more of a necessity for actually being able to function with your prosthesis. So trying to chew with these things that are moving around is not very, that's something you're doing multiple times a day. So those are things that I find to be much more life-changing and necessary than doing a gum graft to cover up one bit of recession. So recession is kind of, it's not like life or death or something.
Thank you. The next question is do you know if it's possible for high school students to become members of the ASDA?
I actually have no idea, but I don't think it'd be hard to find out. So, I mean, I definitely know college students can be in ASDA, but I don't see why they would limit to only college.
Thank you. Our next question is, how long do you have to wait after implanting to put on a crown?
3 months. Well, it depends, but generally 3 months. Some people, there's different types of implants, different types of surfaces on the implant. One of them is known to kind of osseointegrate a little bit faster, but just my general rule of thumb is 3 months. And fun fact about implants is that they were discovered by a doctor in Norway. I believe it's Norway. He was doing implants into rabbit tibias and found that titanium actually integrated into the bone. So that's why we use titanium implants, because it will actually integrate into the bone. The bone will integrate around it.
That's so interesting. Thank you. The next question is, do you recommend vibrating or manual toothbrushes?
So we have a lot of studies about this. Honestly, I don't care what type of toothbrush you have as long as you're using it right, which is pretty straightforward, but I'm happy to demonstrate if anyone needs that. Flossing is also important. So the brand or type of toothbrush really isn't as important. Just make sure you're not like aggressively brushing horizontally. That will lead to some gum recession. I use a Sonicare, but I'm not, promoting that for any particular reason, just what I like.
Our next question is, what do you think made your application competitive when applying to Perio residency?
So again, I think it was the people that I knew, which, so the program director in Colorado was actually really good friends with the program director in San Antonio. And one of the people that was working in the perio clinic in my Colorado dental school was a recent graduate from San Antonio as well. So I think just getting to know him, I was in that Perio After Dark, kind of that club, which was dental students. And also, I had a bunch of guest speakers come in. I think that kind of set me apart. And I was actually able to get that to be an elective course. So people were getting like 1 credit or something for doing it. And I think that was like the most monumental thing I did. So yeah, just the people I met, and I guess they might have put a good word in for me, and just, my grades were pretty good too, but I was never planning on doing a specialty. It just, luckily I did well my first and second year, so it helped me out.
That's great. The next question is, for the clinical aspect of your residency, was it hard to find your own patients, and how did you accomplish getting patients each week?
So, the majority of our patients were referred from the dental students, so we didn't have to like go out on the street and find our own patients. But it also really helped just making relationships with certain dental students. They would come rotate through our clinic and just basically being nice to them and trying to teach them something. Then they would text or, write a referral with my name on it, which is the exact same way that I practice now. It's all about relationships. Most dentists don't care really, like they don't know how to critique what I'm doing, but if they like me as a person, then they send me patients. So as weird as that it is, it's the reality of it. So that was very similar in residency too. So first off, we just start getting patients that are assigned from our faculty, kind of random. But then as the years go on, you make friends with like the other residents and the other, the prosthodontists, the orthodontists, and they'll send you direct patients too.
Do you have any advice for students to make connections with medical professionals?
Well, I guess it's hard, like just out of the blue, but generally, if you have just any connection, if most offices, if you just call and ask to come shadow, I don't know if they would turn you down. I don't think they would. I did that with plenty of dental offices when I was applying. I went to like orthodontists, I went to a couple dentists, and I never had one like shut me down and not let me come in. It might be different during COVID, but I think you just really have to put yourself out there. You really have to hustle. You really have to be your own advocate. Don't expect things to come to you. You really have to follow up with people. So if you met someone at a random event, you have to really follow up with them and not expect them just to come to you and say, hey, you want to come check out my office and spend the day with me? So generally, like, someone you know will know somebody who knows somebody. So you just have to like ask around. You really have to be proactive about it. Is probably the only advice I would have there.
That's great. Thank you. The next question is, what was your thesis about for your research?
My thesis was on the radiographic detection of dental calculus. So dental calculus is not the math. It's basically the calcified tartar on your teeth. And there's a really old study from 1986 that we were kind of replicating in a way with modern technology. So we are always quoting literature in perio because maybe because all of my faculty were Air Force and they're just really, preparing us for our board exams. But we always quote this article about this sense, everyone probably heard sensitivity, specificity, positive predictive value, negative predictive value, looking at X-rays as a diagnostic test for detecting calculus on teeth. And so we took a bunch of digital manipulations now that we have digital radiography and looked at like an invert, emboss, auto contrast, just to see if any of them made it any better. And ultimately it didn't really make a difference. So, but yeah, stay tuned for an exciting journal to come out.
That's super interesting. Thank you so much. Mm-hmm. Another question is, what does a typical day of work look like for you?
Yeah, so it kind of differs every day, but generally, let's say I do 3 surgeries a day, see probably 3 new patients and see a couple post-op. So compared to a general dentist, like they see way more patients than I do. My boyfriend's a general dentist, he sees probably 40 patients a day. I never wanted to do that. So I see, less patients, but generally for more time. So just in an average month, I see about 20 to 25 new patients. So I'm sitting down, doing an exam, taking those pocket depths around their mouth with my little periodontal probe. I'm looking at their x-rays. We're talking about their treatment plan, their treatment options. And then the next time I see them is generally for the treatment. So, whether it's an implant or a gum graft or a tooth extraction or an emergency or whatever. And then I see a couple people just follow-ups 2-3 weeks later. I'm taking out sutures. I'm making sure their healing's going well, changing their little temporary prosthesis because we have to do something to replace a missing tooth. And then I also see emergencies. So sometimes I have to do like an emergency tooth extraction, bone graft. But those are probably the majority of the procedures. I also do hygiene checks. So my hygienist is cleaning my patient's teeth, the ones that are there, just recurrent. So I go pop in, say hello, take a look. That's kind of a typical day. And I generally start seeing patients at 7:20 and I work until 4, except for on Fridays, I work until 2, but I don't take a lunch break.
Thank you. The next question is, how do you deal with the physical stress that comes with dentistry? Do you work out certain muscle groups or get massages?
I do need to start getting massages, but well, it's definitely important to try to do some like stretching, try to like do a lot of these. I work out just mostly as like a stress relief, and I think just trying to strengthen like my back and my core, because that's the first thing to go when you're sitting and hunching over all day. It's also just important just to like find a mental break too. So, glass of wine, whatever, painting, having some fun with your friends, or not that that's easy to do. But yeah, it is definitely like there are some really stressful times because people are in pain. Some people will just tell you they just hate the dentist, which is like, okay, thanks. So you're just really starting off on a good note here. But then there's also the people, I think on Monday I had this lady who had been avoiding the dentist for 40 years or something. She was so anxious. And by the time we were done, she was like, thank you so much. Like, this just made it so much better than I ever thought. And this, you have no idea how much this means to me. Just, treating her nicely and like explaining things to her. And that's really like the moments that really mean the most, is when your patients who are super scared or worried, you can kind of change their perspective.
Thank you. Another question that we have is, how do certain diseases present in the mouth, such as Crohn's disease, which you touched on a little bit earlier?
Yeah, so Crohn's disease, you can see these little cobblestone pebbly appearance in the buccal mucosa, which is like in the cheeks. Leukemia kind of shows up as kind of purplish, boggy looking tissue that has no other real indication. You can see metastasis from cancer in many different ways. Sometimes there's lesions in the bone, sometimes there's lesions on the tissue. So we have to look carefully not only at the gum tissue, the floor of the mouth, the tongue, the back of the throat, the roof of the mouth, but also on the x-rays to make sure there's no kind of cystic-like lesions or any type of radiolucent, which are kind of dark looking things or lesions. So there's a lot of things to look out for, really. And then squamous cell carcinoma is kind of the most worrisome type of cancer of the mouth. So we always have to keep an eye out for that. Even, psoriasis can show up on the mouth, different types of immunologic deficiencies, scurvy shows up in the mouth. There's many more things too.
Sorry, my mute button was blocked. The next question is, a student has a friend that often gets tooth pain from food stuck in his back teeth when chewing meat. What would you recommend doing to relieve the tooth pain?
So that's something we call like food impaction, which can be related to teeth like to be a certain space between themselves. So they like to be, contacting each other, but not too tight. But if that contact is open, then you end up getting food stuck in there. So, the teeth, and it really serves a function, which is keeping food out of those areas. So generally, if there's a space between the teeth, that's when you start getting food impaction. So the things to do to treat that is either orthodontics, like braces, or maybe a filling to close that space.
Thank you so much. Our next question is, how did you prepare for your interviews when applying to dentistry school?
So I'm a very visual person. I make kind of like idea boards, I guess. I just had a sketchbook and I wrote down just a bunch of questions I found online. There's kind of like common questions. And I just kind of wrote them out and just wrote down like what was my first response to that. And I think for me, just writing it out, getting the idea out there is helpful. So that's kind of what I did. If you can talk to people who've been, gone through the interviews, that's helpful. But generally there's just like a list online and just kind of helps you get your brain thinking. And I think, so when I interviewed for my residency, I won't say who it is because I don't know if I'm supposed to say, but one of the interviews was just really random questions like, if you were a superhero, what superhero would you be? If you were a color, what color would you be? Just like really obscure things that you really can't prepare for, but it's kind of good just to, I don't know, think of just really random things. I got asked, what was the last book you read? Or what's your favorite book? It's not always like really straightforward things off the internet. So I think just really, I actually did this thing where they videoed me on a mock interview and they kind of pointed out what was good and bad. And that was really embarrassing, but also good just to see if you have any nervous tics or if you say all the time or just things like that. It's kind of like a speech class in college, but I think that was helpful. But, I've talked to so many people who've interviewed people, and especially my residency, all they were looking for is like someone who can talk to you and is a normal person and can be a fun person to add to the group. So it's not always, are you saying the right or wrong answer? It's just trying to be relaxed and trying to kind of let your true self show and not be a rehearsed answer.
Thank you. The next question is, have you ever dealt with imposter syndrome?
I think that definitely there are times, like just since now I'm finally at the end of the initial goal, which was to be a periodontist, there are times when I'm like, oh my gosh, I shouldn't be doing this. I'm not trained for this, but then I realized, okay, I am trained for this. This is how a lot of people feel. And I don't know if that ever goes away or not, because I mean, there are people who think they're like super awesome, but I think it's really good to be self-critical, and that's a big part of why I take so many photos in my surgeries, is I'm always critiquing myself and trying to get better and learn and do new techniques. And so I think that keeps you really humble for sure.
Thank you so much. Are there any specific or special types of equipment that periodontists get to use?
Yes. We generally have like the more delicate, nice instruments. I don't really have an example, but for example, like a needle driver, a lot of people use kind of a hemostat looking thing, which is like a big scissor. And we use this nice, like delicate, it's called a Castro Viejo. You just have to use like 2 fingers to hold it. And just everything is kind of geared towards being atraumatic, gentle, aesthetic. You know, we're kind of known for being like the ones who are critical of appearance and the soft tissue, and being, you know, the people who care about that stuff, I guess. So, but yeah, there are fun instruments that we get to use, and there's so many different toys out there. I mean, for every type of procedure, you can have a new toy for.
The next question is, what are the things you learned in practice but not in dental school?
Well, let's see. I mean, it's one major thing is just working with general dentists. I have to, every time I see a patient, I write a letter, I describe all my findings. I try to communicate with them, which is a lot more than I ever really had to do in residency. So I think just communication is a really big part. That's a little bit different. Procedure wise, I mean, everything I do, I was really well trained for, so I don't feel like anything is really out of the blue. Yeah, I mean, I can't say enough good things about my residency, because clinically we are super just ready to hit the ground running in terms of procedures, but there's still going to be certain procedures that I haven't done quite as many of, and I'm still working on, perfecting. Like, I've done tons of dental implants, but I haven't done a ton of, certain types of gum grafts or something. So, but it keeps it interesting. I'm always being challenged, and that's sometimes hard, but I know it's good for me because I don't like to be, I get bored easily, I guess.
You talked a little bit about your experiences with research, and how did you get over your initial struggle of not feeling like research was maybe your thing when you had to research in your residency?
Yeah, I mean, there's a lot of things in residency that you do that you don't really want to do. So I guess it's just kind of part of the deal. I think it was just part of setting goals, small goals, and trying to achieve them, not all at once, trying to make it realistic. I guess that's all I really could do, is set a goal and try to achieve that, and then feel like I accomplished that, and what's the next thing? So there's not a lot of things, like I don't love spending 3 weeks studying for an exam, but that was also part of residency. So research was just another thing that, I would way rather be seeing patients or doing surgery or something, but it was just kind of another thing on the list that I knew I had to get done.
Thank you. The next question is, how have you dealt with cases where a patient needs care but does not have the funds or insurance?
So that's super hard, because I always want to help people the best I can. And one example is, even yesterday, I took out some teeth on this lady, and I really wanted her to do a bone graft, because if you don't do a bone graft when you take a tooth out, you'll have 30 to 50% shrinkage of the ridge of bone, which makes it much harder to place an implant in the future, even if she doesn't think she's going to do that anytime soon. So, don't tell my associates, but we charge for one bone graft, and it ended up having extra and just putting it in other areas. Kind of, there's always times where, if I'm doing one thing and I'm in the area already, I'll just kind of do the other thing, I guess, depending what it is. If some people it's really limiting if they just cannot afford a single darn thing, because I'm not able to just give everything away for free, because I'm not the owner of my business. So I can't make all of those decisions. But generally, when you educate people well enough and you really make it something that they realize is important, especially gum disease, that's kind of the biggest thing, because people will just lose their teeth if they don't take care of that. Once they're educated, a lot of people will find a way to make it happen. It's like, do I need to buy a new car, or should I save my teeth this year, or things like that. So it doesn't have to happen within a week or two after I see a person. A lot of times they'll come back 1 or 2 years later.
Thank you. Next, can you talk about your patient interactions and what you've learned so far from practicing?
Yeah, I've always loved working with patients. I think in residency, I spent so much time with my patients. I got, you get kind of invested into them, and it's a little bit different in private practice because I have now other people helping me, assistants or my treatment coordinator, who are doing some of the things I used to do, like call in their prescriptions and stuff like that. So I think now I'm able to focus just on their treatment, which is great. But I see many more patients. So just trying to keep track of them all is one thing. And it's a little bit different in private practice, just the fees are much higher than in school. So, just being cognizant of kind of what I'm telling people I recommend and whether or not they can actually do it. So every single day, is a learning experience.
Thank you. The next question is, in what instance would you choose a crown lengthening procedure over a gingivectomy?
So a gingivectomy is actually a part of crown lengthening if we're talking about aesthetic crown lengthening. So the main issue is that if the tissue likes to be a certain distance from the bone. So if you just cut off the gingiva, like a gingivectomy, if the bone is a certain distance, the gingiva will just bounce right back. So that's why we have to remove some bone to create that 3 millimeter space, but lower down. So there are some cases we can do a gingivectomy and not need to do anything to the bone, but almost the majority of the time you also need to remove bone around the teeth.
Thank you. Next, could you talk about what the most difficult aspect of being a resident was for you?
I think it was just trying to juggle many very different things. So in a given week, maybe I have a big surgery and I also have my research presentation and I also have some type of we had a lot of just random presentations and exams. So I think just trying to, take care of myself, which getting enough rest and, physically just trying to take care of myself and juggling all those things without really getting too overwhelmed. So that was probably the biggest struggle. There wasn't really one specific thing, but it's a lot to do.
Thank you. The next question is, a student is asking if teeth whiteners are generally bad for you.
So that's definitely not my area of expertise, but I would say for sure I know for a fact that any of the charcoal stuff is bad for your teeth because it's just creating microabrasions on the surface of your teeth. I stay away from anything like that. Most types of bleaching and stuff is pretty safe. I don't have anything wrong with it. It just can create tooth sensitivity. So that's just something to be aware of.
Thank you. Next, how did you pick which schools to apply to?
So for dental school, I really kind of picked it on location. I really wanted to stay kind of in the western part of the country. And so that was a big factor for me when I was applying to dental school. Obviously, I wanted to also be a good dental school, but I applied to places like Washington, Oregon, Colorado, Arizona, just places I kind of had some connection to or was kind of close to where I had friends and family. I wasn't really too interested in being one of those people who applied to like 30 different schools, unless I, maybe if I didn't get in my first time, I would have had a different experience. But luckily I was kind of able to pick and choose based on the location. And so when I went and interviewed, I interviewed a couple different places. And after seeing the school, talking to the students there, and you kind of get a feel for which place fits you best. So Colorado actually was my number one choice. I loved the area. The school was beautiful and new. And students seemed happy. That's an important thing. And I ended up getting in here. So that's kind of how I ended up in Colorado. I guess I should say one of my other top schools was in California, and I didn't get into it because my entrance exam score was like 1 point below their threshold. So I was at this kind of turning point of, do I take the test again, risk getting a worse score and maybe getting into the school, or do I just stick with what I got, which I'm so glad I did.
Thank you.
And then residency was more, what residency is the best, I guess. So I had never been to Texas, so I didn't know if it was somewhere I necessarily wanted to live, but just from talking to other periodontists, everyone just talks so highly of that place or that program. So that's kind of why I chose there.
The next question is, what is the most interesting case that you've seen?
Well, that one I mentioned about like the meningosteal and the brain thing, that was a unique one for sure. I think it's more based on the patient versus the case. I see there's not that many different variations in the mouth that I've seen that have really thrown me for a loop, but just the different types of people I've met have been the most interesting. I'm sorry, nothing's really standing out as in terms of like teeth or gums or something just super bizarre, but I think just the people, like some of them really stand out as being awesome patients. And like, for example, my dental school patient was friends with a girl from Colombia, and then I ended up going to Colombia and staying at her family's house for 5 days. So that was cool, but just the people you meet.
One last question that we had is, were you trained using a dental loop magnifier, and what were the pros and cons if you were?
Yeah, so it's I don't know anyone who doesn't use dental loops. So for anyone who doesn't know what loops are, it's just magnifying glasses basically. So we get fitted for them like our first semester of dental school, and we have no idea what we're looking for at that point. We're just trying glasses on. So I have some that are 2.5 magnification. They go up to maybe 4.5. So depends what you're trying to use them for. For me, I like to be able to see like a broad area, and I don't need to see microscopically like a root canal specialist does. And they actually use microscopes. I haven't really ever used a different magnification, so I'm just used to what I have, and I've had the same loops for like 8 years now. So it's only like the old dentists who used to not use loops.
Thank you so much for this presentation. I just wanted to wrap this up by asking you if you have any final advice for pre-dental students or pre-health students in general.
No, I think just get out there, meet people. Don't zero in on one thing, because things will come along that you didn't even know existed. Even if you think, I had a friend who her whole life wanted to be a doctor, and then first semester of college changed to like an engineer major. So I never knew in college I was going to be a periodontist. I think that would have been overwhelming to know how much school I had left. But just take it 1 year at a time, and don't get overwhelmed by the amount of time involved. It's all worth it. I'm not jealous of the people who were out of school when I was in school. Well, maybe once in a while, but I think just being able to continuously learn and grow is so amazing.
Great, thank you so much. That finishes our Q&A portion. So for all of my students, stick around to figure out how to take the post-shadowing assessment, and we'll get into that. So I'm going to go ahead, Dr. Hyer, if you could unshare.
Well, thanks for
So,
having me.
thank you so much for joining us today. Students, for you guys, just be sure that you guys are reflecting on all of the shadowing sessions that you guys are having. It's super important, especially as we work to apply for our next school, whether that be dental school, PA school, nursing school. They're gonna ask you in your personal statement, you know, what did you do and why, what did you learn from this? And so to make that easier for you in the long run, just be sure that after all of these shadowing sessions, what was your biggest takeaway? What inspired you to join us today? And what really resonated with you? So if you guys want to, we would be more than happy to hear from you. This QR code brings you to our website, and you can scroll all the way to the bottom and there will be a comment section. You guys can go ahead and comment your reflection, or if you're not comfortable, you guys can keep it to yourself. It's totally up to you. Another announcement, this is a different QR code than I had shown previously. This is actually to join our fundraising team. So we ask that you guys share to 5 people for all of us who are joining today. If everybody's able to share to 5 people, we will gain enough money to hopefully keep our program running for the rest of the month. This is a free program. We are working to keep virtual shadowing accessible for all students. And so we are asking for your support. Upon sharing this, you guys can actually get verifiable virtual volunteer hours. And so I will talk more about that in the next few slides. We are taking applications to join our student team. It is 100% remote, and it's a great opportunity for you to gain any leadership experience or professional experience that will help you on your journeys. A lot of the things we do aren't necessarily skills that we've developed already. A lot of the things we're learning, you know, maybe I'm a STEM major personally, and I'm learning a lot about marketing. I'm learning a lot about business. And so kind of just getting those different skills under my belt is really awesome. And I encourage you guys to apply if you're interested. If you currently don't feel like you have enough time to commit to this program, that's totally okay. We understand you guys are all pre-health students and you have a lot going on. There are volunteer opportunities open. It's awesome because it's 100% remote. You can work on your own schedule. If the only time you have is at 1 in the morning, you're more than welcome to help us out at 1 in the morning and still get your volunteer hours in. So I have the QR code for it here. You can also find this on our website under the contact tab. Another update, to make sure that you never miss a virtual shadowing session, be sure to follow us on Instagram. We post every single session. And I have a challenge for you today, and that will be to go to Dr. Hyer's page, or to our page on Dr. Hyer's profile picture, and on her post you're going to comment her last name letter by letter. The way that the algorithm works, it's really difficult to do this, so any student that's able to get it in order all together will have the opportunity to be the student spotlight of the session. Tag us in your posts if you joined us today. You can tag us at pre-health shadowing and use the hashtag pre-health shadowing for the opportunity to get reposted on our official Instagram, Facebook, Twitter, and TikTok. Our next shadowing session is next week. To get your verified virtual shadowing hours, you're going to go to our website and go to all shadowing sessions until you see the profile for our professional today. You're going to click free take this course, and once you do that, it'll take you to the module where you can take the assessment. You will have 30 minutes to complete the assessment and 2 tries to get over 70%. Upon receiving a 70% or higher, you're eligible to receive your certificate. Your certificate can be downloadable immediately or can always be found in your profile under the certificates tab. Please ensure that you have clicked finish course. If you have not clicked finish course after passing your post-shadowing assessment, you will not receive your certificate. Another recommendation is if you take the quiz the first time and receive a passing score, and you want to try to get higher, I recommend that you download your certificate before trying your second attempt, because if you fail the second time, your eligibility to receive your certificate will go away. If you guys have any questions about this, feel free to reach out to us at info@prehealthshadowing.com. And another thing really quickly before I wrap this up is our website has been crashing out a lot lately due to the load. So I encourage you all to wait between 15 minutes and an hour to take the assessment. If you would like a refresher to rewatch this virtual shadowing session, it will be posted on our YouTube channel and website within 24 hours of the session end time. Thank you all for joining us today, and that concludes our virtual shadowing session. I invite you to disconnect from the call. Thank you. Thank you so much, Dr. Hyer. That was amazing. I learned so much.
Cool.